Thank you, Cam and Gavin. I appreciate it. I'm here with Doctor. And Doctor, how are you today?
I'm well. How about
Very
you?
good. I'm hanging in there, kid.
I'm doing fine.
And you are from what dental group?
I'm part of Amador Dental Specialties.
Okay, because I had that wrong. I want to talk to you about something that I find really interesting that you were telling me about. You said that in the near future, they are doing things with your glands. And
Yes, there's a new field that's out. It's called salivary diagnostics, and it's being studied extensively, particularly at UCLA. There's a guy down there named David Wong. Brilliant man. Actually, saliva reflects what you have in your bloodstream. And if they can characterize what pancreatic cancer represents as certain chemicals in the bloodstream, or ovarian cancer, we may be able, and this will come very soon, identify that by taking a swab in your mouth, put in a little machine in the practice, and serve as a screening device for these horribly invasive cancers that are difficult to diagnose.
And how interesting is that? Because how many years ago people said, oh, with the swab, you can't tell somebody's DNA and this and that. And look how far that they have come. So, and you know, and to the defense of even the older generation out there, a lot of them are afraid to go to the dentist. They're afraid that their work is going to, first of all, the pain, which today there is no pain. Even if you, I mean, it is so, I used to break out in a sweat. Now
we all
it's
work
nothing.
so hard to minimize that.
Absolutely.
With using topical anesthetics, with buffering our local anesthesias, and doing everything we can. Now, the laser technique that I use for the treatment of periodontal disease, that laser technique in and of itself is so much less painful. In fact, patients that have had both the surgical treatment and the laser treatment, there's no way they're going back to the surgical.
Sure, no, because the surgical was a little painful. Not only that, Doctor, I think that it's really important for people to understand, and you put the emphasis on this. When you don't take care of your teeth, you're not taking care of your whole body, because your teeth affect so many things in your body.
There is no doubt that all those microorganisms that are around your teeth that are associated with periodontal disease have a dramatic, we're not isolated. That's not all there by itself.
Right.
There are ways for all of that bacteria and all their products to get into the rest of your body, and as far away as causing premature birth and low birth weight, and causing heart problems and cardiovascular problems, stroke. And there's some definite proof of that. I mean, how difficult is it to prove the factors in heart attack? But personally, I'm convinced that advanced periodontal disease can have a dramatic effect.
Sure, because it just poison goes through your body.
Oh, yeah, absolutely. Yes, you're absolutely
and
right.
people don't realize that they, and not only that, go in, and even if you have to have work done, people can set up a plan for you to pay so much until you to get on your feet.
Yes, if the finances are an issue, there are ways of
right.
Don't
let that stand in your way.
No. You've got to go in for your health to do that, and find out what the options are in an initial examination. We have so many. We were talking earlier. I'm getting close to 50 years now working in the field, and people say, "Well, when are you going to quit, Dr. Frey?" And I said, I don't.
See,
I don't know.
Dr. Frey started dentistry when he was 7 years old.
Yes.
He did that one.
God, I like the
High
concept.
five.
Anyway,
I'm right with you, kid.
But the reason I'm hanging around with this is that all of these new innovations are so stimulating.
Yes.
And there are new things to learn. I mean, I've learned some things in the past few years, but I've got a lot more to learn.
How exciting! I just want to. I would want to keep going and going and going, because it would be so exciting. And I think that it's great that we have somebody that's devoted, and the dedication that you have to help people in our county. I think that's wonderful. If anybody wants to get a hold of you, where can they reach you?
Well, I'm at the brick building across from Taco Bell, which is probably the best way to find me, because everybody knows. And I'm a suite in that same brick building all by myself, and there's a sign on the door that says Amador Dental Specialties.
So all they have to do is give you a buzz and make an appointment.
Yep. That's absolutely true.
So I encourage everybody.
Phone number is 223-3502.
Get in there and go see the doctor. There you go. And if not, you know where he's at, and get in there and get those choppers fixed there. Get them choppers done, as they say. Hey, with that, Doctor, I want to thank you very, very much. We've joked a lot, but you're a great guy.
Been a pleasure.
It's been my pleasure. Thank you very much. We're going to go to Cam and our next guest. You know what?